So I'm Gavin Giovannoni, Professor of Neurology from Barts in London.
And I'm David Paling, I'm a consultant neurologist at the Royal Hampshire Hospital in Sheffield.
So we are having a debate tonight to discuss a new NHS England guideline on the prescribing of disease-modifying therapy in England. Just to give you some historical context behind these guidelines, it's well known that there's a large amount of variation in the country in terms of prescribing disease-modifying therapies for people with multiple sclerosis. And NHS England thought by having guidelines in place on a system called BlueTech, where we add all the patients to a database, and also forcing us to prescribe under a multidisciplinary team approach, like shared decision making, this will get rid of the variation across England. And the debate we're going to have, you may disagree with me. I'm going to say no, and I hope you're going to say it's going to change behaviour.
So I'm going to say yes. I think the rules that we have to work with are incredibly complicated. There's lots of historical anomalies. And what we really need as clinicians is we need real clarity as to what we can do. And I think the guidelines are going to provide that for us, and I think they're going to help our decision making, and I think they are going to standardise practice across the UK, and that's supported by the support of your colleagues within the MDT meeting.
Yes, I think the MET is very good to give us reassurance, particularly with the more risky efficacious therapies. But the question is it going to get rid of variation? Because there is a thing called groupthink. In other words, certain centres think differently to other centres. I don't know how it's going to get rid of groupthink. But let's see how it plays out, because maybe audits across the country will show people that are overprescribing one therapy versus people overprescribing another. Maybe just seeing the variation will make them change their behaviour. But I completely agree with the principle, though. If I had MS and I went to your centre in Sheffield, I want to get the same advice from you as if I came to somebody in London or went to somebody in Newcastle or Preston, for that matter. So the principle of getting rid of variation and getting rid of this postcode prescribing is a really good one for the NHS.
I think one further point is that the disease-modifying therapy algorithm is actually fairly straightforward, and I think it's something the patients will use as well, and they will come up to their neurologist, and you and the patient can have a clear, informed decision with what you can and can't do, with real clear guidance, and before that hasn't been available. So I think that's going to drive change as well.
Well, let's see what happens. The guidelines at the moment are under public consultation. I think there are going to be some changes because the Cluzumabs have taken off the market. There's quite a big group of people who want HSCT. Sheffield is leading that lobby to get HSCT more prominent on the guideline. And so let's see what happens with the final guideline. But we're going to have to do it. There's going to be no alternative.